This is the presentation of the effect of inclusion on the social skills of children with autism spectrum disorder in elementary school by Dione Morgan with the University of Northern Colorado. In early childhood, most preschools are fully inclusive. This means that children are educated in the general education classroom and they receive all of their services in the classroom with their typically developing peers. When children go to kindergarten, the increasing demands on their social and academic skills often result in them being educated outside of the general education classroom in a greater percentage of the time. The problem with this is that it is difficult to generalize social skills when they are not taught and utilized in the child's natural environment. The review of literature begins with stating that students with special needs must be educated in the least restrictive environment to the greatest extent possible. This means that we want children in the classroom with their typically developing peers as much as we can, while still providing the level of support that will give them success in elementary school. Children on the autism spectrum have difficulty with social interactions, which often requires a higher level of support. In addition, many teachers feel unprepared to deal with the demands of these challenges. There are some strategies that have been found to be successful in keeping children in their general education classroom, such as visual cues, social stories, and direct instruction from adults. These have all been shown to be beneficial in the inclusion of children with autism. In addition to teacher-directed activities, peer-mediated interventions can actually be more effective. The problem with teaching these skills in a resource room is that typically developing peers are not readily available in a special education classroom. As we discussed earlier, exposure to their peers is very important. Some of the ways we can utilize peers is training a peer to remind the target student of desired behavior when they engage in off-task behavior. This has been shown to be enough to decrease the undesired behavior. Also, children create a peer culture in their interactions. It is within this culture that children learn what is and is not acceptable. This is not something that is going to naturally occur in a special education classroom. In some of the studies, peers were instructed on the importance of social involvement for all children and how they could interact with the child on the autism spectrum. One of the unstructured times that is a prime opportunity for social interactions is the playground. On the playground, children on the spectrum spent 30% of their time unengaged. This is compared to 9% of the time for typically developing peers. Using visual cues on the playground that were provided by a peer mentor increased the interactions of all children on the spectrum that were involved in this study in 2014. There are some successful strategies which have been shown to increase the social interactions of children on the autism spectrum in a general education classroom. These include visual cues, social scripts, peer training, and peer-mediated interventions. We will discuss each of these in more detail. Visual cues can be used to remind the target student of how to interact with peers. These can be used at various times of the day. They are especially useful during any kind of social interaction, can be used during academic activities such as reading time or other times when the teacher is teaching. They can be used during unstructured time such as recess and mealtime. Social scripts have been found to also be successful. Studies have found that direct teaching of social skills and social scripts is necessary to help children on the autism spectrum gain social skills. Teaching social scripts in a separate environment does not lead to children being able to generalize the skill to actual play scenarios. The only time that improvement was demonstrated was when the social script was used in an inclusive classroom during play. It was not successful when it was taught in a resource room and then expected to be used in the general education classroom. Peer training consists of teaching typically developing peers how to respond to students on the spectrum, considering that their initiation of play is often misinterpreted or ignored. Also, teaching the general population of students how to include the target student may actually be more beneficial than attempting to change the skill level of the child with autism. Therefore, teaching the child with autism social skills in a separate room is not as beneficial as teaching the typically developing peers in the general education classroom how to interact with this child. Peer-mediated interventions have been used. There are various different kinds. The first one is called the PEER, which is a peer-mediated version. The Reading Buddies, which is also peer-mediated but designed for reading time. And the CHILD, which is a child-directed intervention. All of these also include direct instruction for the typical peers on how to engage with the child with autism. We have discussed to some extent interventions in a resource room. Simpson and Boyd conducted a study which used peer-mediated intervention during reading time. Results demonstrated that it did improve the typically developing peers' view of the child on the spectrum, but there was no notable improvement in the interactions of the child with autism. The part that is notable about this study is that the children were not in the general education classroom for more than 50% of the time. Therefore, they were brought into the room to participate in this intervention, but they were not in the room during the other unstructured times of the day. So it is difficult to say that the reading intervention was successful given that these children were not in the classroom at other times of the day. This leads to the research question. The hypothesis is that students with autism spectrum disorder who are included in a general education classroom for more than 50% of the school day will demonstrate more frequent positive social interactions with their peers than those in the control group. In order to conduct this experiment, the operational definitions are the inclusion program, which will consist of direct instruction on social emotional skills, peer-mediated interventions, and an increased time in a general education classroom. The experimental group will be in the general education classroom at all times, other than 1 hour each day, in which they will be taught direct teaching of academic skills in a separate room. The control group will have direct instruction on social emotional skills as well, and they will be in the general education classroom for less than 50% of the time. The control group will also not have any peer-mediated interventions. Social skills instructions is defined as using the Second Steps curriculum on a daily basis. Peer mediation consists of pairing a child on the autism spectrum with a typically developing peer. This peer will be trained in the strategies of using visual cues and social scripts, and the peer will meet with the teacher on a weekly basis for support and feedback. The measurement instruments that will be used to monitor the social interactions is the Devereaux Student Strengths Assessment, or the DSSA. This will be filled out by the teacher before the intervention and at the conclusion. This assessment looks at the social emotional skills of children. The other area that will be evaluated is the number of positive social interactions the child engages in on a weekly basis. This will be determined by the Goal Attainment Scale, GAS. The classroom teacher and researcher will decide on the specific criteria used to define a positive social interaction based on each child and their developmental level. This will be tracked on a weekly basis. Here is an example of the Goal Attainment Scale worksheet. It will have the student's name and date, the teacher, the consultant or the researcher, as well as the target behavior indicators. A 0 would be no change in the child's social interactions. A +2 would be an ideal scenario, whatever it would look like for that child to participate in the most ideal positive social interaction they are capable of with their developmental level. A -2 would be the worst case scenario, which would be less social interaction than what the child is currently demonstrating. This will be filled out over the course of a week. As you can see at the bottom, there is a graph of progress divided into days, at where the teacher will log where the child was at each day of the week. This can then graph and look at the progress over the course of the week. Some threats to reliability are first, individual random error. There are many things that could affect a student's ability to engage in positive social interactions on any given day. This will be controlled by monitoring their social interactions over a week at a time rather than emphasizing daily interactions. This will help to look at the entire week rather than just the day. Another threat to reliability is the experimenter. Some teachers may rate students differently depending on their own perceptions and opinions of the child. This will be controlled by giving a clear description of the characteristics of the positive social interaction on the GAS so that everybody is on the same page as to what they are looking for. Threats to internal validity. First would be selection bias. There are a limited number of children entering kindergarten on the autism spectrum. Therefore, these children may not be representative of the general population. Children that are in the classroom a higher amount of the time may already be higher functioning. They also may have more involved parents that are advocating for them to be in the classroom for more of the time. The way that we can control for this is by having an equal number of children at varying levels of functioning in each group. Threats to external validity would be the subject effect. So children on the spectrum have varying levels of difficulty with social interactions. Given that autism is a spectrum disorder, it is possible to have minimal struggles with social interaction or a lot of struggles with social interaction. We can control this by using random selection. This will decrease the likelihood that either group is not representative of the population. The sampling technique, we will use all children in a given district that are entering their first year of kindergarten and have an autism spectrum diagnosis. This is non-probability sampling, specifically a purposeful sample. The number of students in each group will be dependent on the number of children that are in the sample as a whole. This will vary based on year by how many children are entering kindergarten with an autism diagnosis. This will be an experimental design, which the people are randomly assigned to groups. There will be a pre-test for each student, which will consist of the DSSA scores, as well as social interaction tracking that will occur before the intervention. The post-test will occur at the end of the semester, using again the DSSA scores and social interaction tracking. The social interaction tracking will occur weekly over the course of the entire intervention. The DSSA will only be administered at the beginning and at the end. The independent variables are increased time in the classroom, peer-mediated intervention, and peer mentors. The analysis of data will use descriptive and inferential statistical tests. We will get the means for both the DSSA as well as the social interaction tracking. With these means, we will calculate a sample standard deviation to z-scores. These z-scores will be separated into two groups, the experimental group and the control group. These scores will then be compared to see if there are significant changes over the course of the semester and how the two groups compare. This will also allow for analysis to see if there are outliers in the data. Here are the references that I have used for this presentation.